Hey everyone, today we are going to discuss all the important features, key features of hepatocellular carcinoma, the risk factors and the clinical features, the etiology and the clinical implications, how to treat the patient. We are going to capture all the features, so don't go anywhere and jot down all the high points and we'll have great learning today. So hepatocellular carcinoma is more seen in Asian and African countries, with the rate of incidence is much higher in China and around regions. And the median age is generally third to sixth decade in Asian countries, whereas it may be more than sixth decade in European countries. So the median age is quite variable in different regions of the world. Males are generally more susceptible compared to females, with almost like 3:1 ratio is there. Now let's capture all the risk factors. The risk factors are viral hepatitis, including hepatitis B virus, hepatitis C virus. These are the risk factors. Hepatitis C virus particularly, which leads commonly to chronic liver disease. Apart from that, various minor risk factors are there, like non-alcoholic steatohepatitis and alpha-1 antitrypsin deficiency, hemochromatosis. All these are the risk factors for hepatocellular carcinoma. Also, aflatoxin derived from aspergillus contaminant, fungal contaminant of the food, that can also lead to hepatocellular carcinoma. Now, hepatocellular carcinoma generally develops, the tumor mass develops from a low-grade dysplastic nodule to high-grade dysplastic nodule, and in that transformation many of the genetic mutations occur, like KRAS P53 are the common mutations. Apart from that, many other genetic mutations have also been deduced in these stages: low grade, high grade, and then hepatocellular carcinoma. Now coming to the morphology. So morphology, it could be a unifocal large lesion, or it could be multifocal, multiple masses may be there, and it could be diffusely infiltrative lesion which can occupy almost the entire liver. Some large lesions can also be there. So it is histologically it is quite variable. It could be conventional hepatocellular carcinoma with pleomorphic hepatocytes, or it could be various other variants could be there, like well differentiated anaplastic variant with complete loss of differentiation, and another variant, that is fibrolamellar variant, could be there with just separated by cords of fibrous septae and having generally a better prognosis. Other variants that are seen are sclerus, steatohepatic, clear cell variant, chromophobe variant. So many other variants are there, and they may have slight variation in their prognostic implication compared to that of the conventional hepatocellular carcinoma. So clinical presentation, how do it clinically present? Clinically, the patient may have a ill-defined lump in the abdomen, discomfort, jaundice, hepatomegaly, splenomegaly, ascites. These are the cardinal features of the hepatocellular carcinoma. No, so how to treat the patient? The patient can be treated by conventional surgery, and sometimes chemotherapy, systemic therapy, and even ablation by cryotherapy or radio ablation therapy may be also given to treat the patient in an adjuvant way. So these are the mode of treatment. Now, some ISC markers, immunohistochemistry markers, can be used to corroborate the findings, to substantiate the finding. The alpha-fetoprotein is raised in the serum of the patient, as well as in the liver tissue also it may be raised. And apart from that, Hepar1, glypican 3, these are also some important markers that are generally raised in hepatocellular carcinoma. So now let's capture all the high points together. Hepatocellular carcinoma more common in Asian and African countries. Generally male preponderance is there, and various clinical variants are well differentiated, anaplastic, fibrolamellar, sclerus variant. These are the common variants apart from the conventional variants. And hepatocellular carcinoma presents with AFP, alpha-fetoprotein elevation, and there are various other markers like glypican 3 and Hepar1 can be used for the diagnosis in immunohistochemistry. And the treatment includes surgery and some adjuvant systemic therapy and ablation therapy. Thank you.
Thank you for watching the video. Please subscribe to the channel, hit the bell icon and follow in our different groups, and please stay tuned for the next video.